This episode of the Practice of Therapy podcast is brought to you by TherapyNotes, TherapyNotes.com, and also the Google Workspace for Therapists course. Again, you can find that at practiceoftherapy.com/G Suite course. This is the Practice of Therapy podcast with Gordon Brewer, helping you to navigate your private practice journey. This is session number 171 of the Practice of Therapy podcast. Hello, everyone. I'm Gordon Brewer. Glad you've joined me. Hope you're having a good week or weekend whenever you might be listening to this. And I'm so glad you're with me on this journey. I'm pretty excited today. As usual, I record most of the intros and outros for my podcast on Fridays, and today is one day I wish I wasn't inside. It is absolutely gorgeous here in East Tennessee, and spring is here and things are budding. You know that it's a sign of spring when, as we call them here in East Tennessee, the red buds are blooming. And it's, I think there are a lot of different names for the tree, but that is what we know it here in East Tennessee. But anyway, it's a beautiful day. So I just thought I'd share that. I'm looking forward to you hearing from my guest today, Dr. Tom Young. And Dr. Young was a person that had reached out to me a few months back, but he is a physician, and he has developed a screening tool for other physicians and just helping them with looking at when they need to refer out to mental health providers. And so I thought this is a great topic and certainly perfect for our niche here as you listen to this. And so I'm looking forward to you hearing from him and the tools that he's put together with his team. He's the founder of nView Health, and so you're going to get to hear from him and learn more about his story and the tools that they're providing. One of the things that I will say before we get to the interview is that I remember back when I first went into private practice, one of the best ways to get referrals, I think, was from physicians in my area, and just being able to reach out to them and let them know that I was taking new clients and all of that. And so anyway, I'm looking forward to you hearing from Dr. Tom Young here in just a moment. But before we get to Dr. Young, I'd like for you to be sure and go over and check out the Google Workspace for Therapists course. So here is the deal. I'm getting ready to close the cart on that while I finish the updates on the course. So you have until the end of March 31st, 2021, to go ahead and get that course at its original price. I'm going to close the cart so I can finish my working on the updates for it. But when you purchase it, you will get the updates, and you'll get, even though I closed the cart, you'll still have access to the course. It's just that new people won't be able to buy it for a while until I get those updates. So wanted to make you aware of that, and the price is going to go up. But currently, you can still get the course for $98. And what the course does is essentially teaches you how to use the different tools and some hacks and that sort of thing for using Google Workspace within the private practice context. And in particular, learning how to make it HIPAA compliant and HIPAA secure, and then being able to use it as a practice platform, in particularly the business side of your practice. So anyway, be sure and check that out. And you can get to that by just going to practiceoftherapy.com/G Suite course. It's still under the old URL before Google changed the name to Google Workspace, but it was formerly known as G Suite. So anyway, be sure and check that out and take advantage of getting it at its original price before the price goes up here in a few months. So I just wanted to give you a heads up on that. If you're on my email list, you would have gotten a notification about that. But we're running out of time here, folks. It's just a few more days till the end of March, which is hard to believe in and of itself. So be sure and check that out. And before we get to my conversation with Dr. Tom Young, I'd like to invite you to go over and check out our sponsor for the podcast, TherapyNotes, TherapyNotes.com. They are the leading electronic health record system for mental health providers in private practice. As I've mentioned before, they are who I use in my practice, and it is just a wonderful tool for me, and I can't say enough about them. It really contains everything you need in terms of documentation for your practice, also scheduling, being able to use telehealth within the same platform, also being able to bill insurance companies and do electronic claims through TherapyNotes. Also, their support is just second to none. They are responsive and will absolutely help you with any problems you might run into. We recently added a therapist, and we had to transfer their records from a previous practice, and they did it all for us at no extra cost. So it's a wonderful tool, and I highly recommend them. So be sure and check them out. TherapyNotes.com. And if you'll be sure and use the promo code Gordon, just GORDON, you can try them out for 2 months for free. So it's really a win-win situation. So be sure and check them out. TherapyNotes.com. And so without further ado, here's my conversation with Dr. Tom Young. Hello, everyone, and welcome again to the podcast. And I'm so excited for you all to get to know Dr. Tom Young. And Dr. Tom reached out to me about being on the podcast. And when I started learning about what he's involved in, particularly from the medical perspective of helping doctors connect with behavioral health providers, and just some of the things that have come up over this past year, I knew he was a guest that we'd want to have. So, Tom, welcome to the podcast.
Oh, it's a pleasure to be here, Gordon. And I'm really looking forward to the conversation.
Yes, me too. So as I begin with everyone, kind of tell folks kind of how you've landed where you've landed in your journey, and a little bit more about yourself.
Great. Happy to do that. Now, my journey started in medicine, particularly in family medicine, where I came to where I live now, which is Boise, Idaho, from Texas, where I trained. And what I found, as most family physicians find, is that, there's always the other part of people besides their physical or medical health, and that's their mental health, behavioral health, their emotions. And like most young physicians, maybe was not as well schooled back in those days. Mm-hmm. I taught medicine for several years, and in those adventures began to think more about it. And all along the way, for all the things I've done, have been sort of beginning to really understand the depth of that. I had the opportunity to be the medical director for Medicaid for many years for the state of Idaho. And in that position, I really began to see the interaction between primary care providers and people's mental health. Mm-hmm. And so started my journey into looking about how to make that better, how to make that something that physicians could do. And that's what brought me to found nView Health, is a way to create tools, mm-hmm. assessments for primary care physicians, pediatricians, nurse practitioners, PAs that were seeing people in the trenches. It came from the concept that primary care providers provide about 85% of all the diagnoses in mental health in this country today. They write about 80% of all the prescriptions for psychotropic drugs. And unfortunately, their rate of getting the actual diagnosis is relatively low. Not because of any intent, but because we really haven't provided tools to help.
Right. Yeah. I love this concept because I think a lot of times, I know even my own practice will get referred. First of all, I think that one of the things that is, particularly for those of us in the mental health space, particularly for those of us in private practice, one of the things that I've really kind of discovered once I got into private practice is that a lot of doctors out there really are sometimes struggle in finding who to refer to. And they see that with their patients, they have some mental health problems or some behavioral health problems, and just knowing how to steer their patients in the right direction. And then just that whole communication between the therapist and the doctor is such an important piece. But how are you finding that a lot of doctors are kind of broaching this whole thing? Because I know one thing that has happened over this past year is that mental health has become an okay topic for people to talk about as a result of COVID and all of this sort of thing.
Yeah, you're absolutely right, Gordon. The concept of mental health has really changed over the last 12 months. It's become part of the pandemic, part of the essence of the pandemic. It's what I call sort of the tsunami behind the pandemic. Increased anxiety, increased depression, increased notice of behavioral health disorder at all age brackets. Characteristically, we really don't think too much of children ages, in the young ages, but we're seeing it with children now a lot more than before. And in our work at nView, we work with a lot of groups who are now focused on things like anxiety for children and working to find solutions. But I think the key issue for primary care is getting the right initial assessment. It's kind of what we call the tip of the spear, because if you don't know what you're looking for, and you don't know what it is, and you don't have a way of initially finding it, how do I screen people in my practice? There are some screeners out there. Unfortunately, most of them are focused on the symptoms. So it really doesn't help the primary care doctor essentially understand what are my options. So I'll give you an example. If I think the patient's depressed, that may be my level, but I really don't think about the fact that this might be depression with psychosis. This might be depression that's bipolar. It could be a depression secondary to PTSD. I really don't get that depth in the current assessment tools. So what we've focused on is providing a tool that's quick and easy. It takes a couple of minutes for the patient to fill out, and it really lets the primary care provider, whether it's pediatrician, because we have children's versions, find out what might be going on. And with that finding out what might be going on, now I know what to focus my energy on. Now I find out who might be the best provider in my community for that. So in terms of how we interact then with the behaviorist in our community, we have to be able to tell them what we think is wrong, have them start their intervention process, and then together we need tools that follow along. How is my patient doing? What's the progress? So we focus on that spectrum of assessment, initial sort of diagnostic tools to help physicians make the diagnosis. The tools themselves don't make the diagnosis, but they provide information. I like people to think about what we do as kind of like the standard of what we as primary care docs do. You come in, you tell me what's wrong. I focus on a particular possibility of what might be going on. and I order some appropriate tests. Maybe it's an EKG, maybe it's an X-ray, and I get that back, and that helps me focus what I need to do next. Same thing's true here.
Yes, yes. I love that concept because I think a lot of times um, what can happen is I know we can first of all, I'm a big proponent of coordination of care with the medical side of things. And I know, having worked in an agency in the past, one of the things that is so important in getting, when we get patients, is that we get them medically cleared, just to rule out any sort of some sort of underlying medical condition that could be causing things. One that comes to mind is just if somebody's got say, for example, a thyroid condition, it can present as something, but just depression and a flat affect and all of that kind of stuff. And, it really needs to be ruled out and just on our side of things. What have you found that, in that coordination of care? And I want to get to here in a minute a little more detail about how this assessment works. But from what do you find that most doctors are looking for in being able to coordinate care with mental health providers?
I think for the most part, primary care providers want to understand how their patient is doing, because it's like any other referral process in medicine. I send my patient to you with the hopes that you're able to help them. They come back in between for something medical. I want to be able to converse with them about their progress with you in that visit. But if I don't know what's going on, I feel left out.
Right.
And I think that's where some of the fractured relationships occur. I send that patient to you and then I never hear back. And I think to coordinate care, there are a lot of ways to do that. It can be by phone call. We can discuss the patient. You may use tracking tools, things to assess the patient in between visits, sending me a copy of those so that I can see that my patient is getting better.
Yeah.
Are very valuable. And so I think all of those things are what we talk about when we say coordinate care.
Right.
The other part that I think is important is if I'm using medications, then I need to understand if you're seeing any of the side effects. Perfect example. I decide based upon what I've found out about the patient and my diagnosis that they are depressed. They're maybe an 18-year-old or a 19-year-old college student, and I give them a medication. Well, as many people know, some of these medications will drive suicidal thinking. So I need to coordinate with you, who's seeing this patient maybe every week, to understand, is that going on? Are those questions being asked so that you and I together can be careful with the patient? So I think that's where it comes in.
Right. Yeah, I think that's such an important piece, because I know one of the things that I know, again, in just thinking about my own practice, I know when we first do an intake with a patient, it might be that it's going to be helpful to know if they are on any medications, and also being able to refer back to their doctor. If we feel like they could be maybe benefit from some medication. Do you find that that's happening a lot with patients where and just your work with other doctors around the country, that their therapists are referring them back to the doctor for those things?
I think that happens a lot. I think that, and that's a very appropriate relationship between physician and therapist. And I know more and more primary care providers are beginning to even integrate therapists into their practices, particularly in areas like federally qualified rural health clinics, FQHCs. A lot of FQHCs around the country in rural areas will integrate the therapist as part of the office, if you will.
Mm-hmm.
So I think those relationships are beginning to build. I think we're seeing, as you mentioned earlier, a greater emphasis on integration of behavioral health into physical health.
Right. Right.
Both physically, where people are moving into the same space, and in the referral process. And again, when I, as a primary care provider, can get more information that says there is an issue here. I do that screening and there is a documentable issue, then I can be more aggressive, if you will, about helping that patient find the right therapy and find the right person to match with their problem, if you will.
Right, right. Yeah, one of the things too, I would imagine on the medical side of things is doctors feeling more confident about what they're diagnosing, but also being able to um, prescribe appropriate medications for different conditions. And are you finding that with the in view application that they're feeling more confident about that?
Well, I think so. I think if I can understand that my patient has, and I'll say a simple, uncomplicated depression,
Mm-hmm.
and does not have, for example, bipolar disease, there are no other comorbid conditions. Often we see depression, as you well know in your practice, that really comes from other things. It may come from significant PTSD. There may be, particularly in adolescence, that depression may come from an underlying eating disorder, for example. So by primary care providers being able to understand the complexity of this individual patient, they can feel more confident in the medications that they may choose.
Mm-hmm. Yes. Well, the one thing that seems pretty evident to me is that, we had talked earlier about the fact that some of the stigma around mental health, it seems to be, I don't have any way of measuring it, but it seems to be kind of dropping because most everybody around the COVID pandemic has felt a significant amount of stress around that, having to socially isolate and all of that, social distance and isolate and all that sort of thing. And I think that people are probably more quick to go to their primary care doctor to talk about these things than they might be to seek out a therapist. And so to me, it's a perfect solution to helping people get the help that they need around that. So you want to talk a little bit more about nView and how it came about and kind of what's how doctors are using it?
Well, how it came about is my wife and I were working in Florida, and we met Dr. David Sheehan, who was a well-known psychiatrist who over the years had developed assessments that were used in the research world, and they still are. Our company provides significant amount of assessment tools into worldwide research. Today, we have research projects going on every continent. Thousands of tests a day are done. And I, as a primary care doc, and as somebody sort of in that space looking at healthcare in general, I saw the opportunity to move some of these tools by Dr. Sheehan, by Dr. Wayne Goodman, Dr. Catherine Phillips, several well-known psychiatrists, and move them into a format or a delivery model that could allow primary care doctors to use them. Because they were devoid of tools. There were a few screeners, but the ability to provide a sharp psychiatric interview at the level of the primary care doc, which would give them the information. And I laughingly, when I started this, says, well, this is kind of like having a psychiatrist in your pocket. And I wanted to give primary care docs that availability. So we started with a screener, which often opens the conversation between the doctor and the patient. I give the patient a screener. It comes right back. I can look at it and say, wow, Mr. Jones, looks like you may be feeling, a lot of anxiety. Is that something that we need to talk about? So it changes the paradigm of the patient having to complain of it and puts the onus in the physician's hand to know what's going on and ask the right question. And then once they do that, the next step in the tool process is the interview that I can quickly do with the patient that helps me, if you will, drill down and get a more accurate picture. Once I have that accurate picture, I can then find out with you as a therapist, or if it's going to be medication, what are next steps. And then lastly, the tools are generated to be able to provide those tracking tools to say, how is the patient doing? If I choose medication, if I choose medication and therapy, and then I can see how that patient does weekly, monthly, however often I want to track it. And then as the primary care provider, I have more knowledge to be able to work with the therapist. If we're not seeing improvement, is it a medication change? Is it adding to the therapy? Do I need to move from pure cognitive behavioral therapy, perhaps to cognitive behavioral therapy with some TMS, transmagnetic stimulation? So I can look at things better and see better outcomes.
Right. Well, it's it's the fact that it's just data based. I think it really is gives it much more. Really much more to work with, I think, on the front end by just having those, those assessments that are based on science, if you will, I think is just huge in terms of helping come up with an accurate diagnosis. And, the other thing that occurs to me is that I think a lot of times, and I see this for people coming to therapy, is that they feel something is amiss, but they can't quite pinpoint what it is. And by having an assessment, I think it really helps them have the language to really express what is going on for them internally. So
I absolutely agree with you 100%. And what's the catchword now? Measurement-based care, but measuring and tracking is also therapeutic. As the patient begins to get engaged and see that things are getting better. Often it's kind of like if you live in the darkness, you can't see the subtle changes in the light.
Right.
And so sometimes tracking together with their therapy becomes therapeutic. And so I think there's not only is it measurement-based care from the outside, you and I looking at our performance as doctor and therapist, but it's also the patient looking at how they're doing and being able to say, yeah, I really am getting better.
Right. Well, I love this idea, and I'm real excited about the the potential for this, not only for helping our patients, our clients, which is, for most of us, that's our primary concern, but also for being able to build a practice more by having more communication with doctors along the way. Do you see that this particular application would be helpful for therapists or people doing more of the talk therapy into things?
Absolutely. I'll use a family story if I can. My daughter is a therapist. And as we got into this, she found that this was a really great way, number one, for her to provide data back to her referring physicians, but also for her to see how her practice was doing. And as she grew her practice using the interview tools, having her therapist use the interview tools, it gave them greater confidence in the accuracy of each therapist's diagnostic skills.
Wow.
And in the college practice that I have, same thing is true. By using the interview tools and the screening tools, we're able to much more rapidly and at a higher level of quality start the process with each individual patient. So for therapists, I think it's a wonderful tool because, again, therapists, like physicians in the new world, are going to be measured on outcomes.
Mm-hmm.
Are the patients that you see getting better?
Right.
And how do you know that? Well, if you use a tracking tool that's attached to the right assessment tools, you have the data that shows you what's going on. And conversely, you have the data that shows you if the patient isn't doing better, which then you as a therapist or me as a physician can make adjustments quickly in what's going on. So yeah, I think we have an innumerable number of therapists who use the tools in their practice.
Yeah.
And a growing number, but again, because it's efficient, gets at the information, collects the data quickly, collects it accurately, and then allows the therapist to follow over time.
Right. And I would imagine that you get the kind of a provisional kind of diagnosis immediately with the tool.
Yeah, it takes about, if you do the screener, it takes about 2 to 3 minutes. We also, and I throw in, all of our tools are the only ones in the world currently that go all the way down to age 6.
Wow.
So we're assessing children from 6 up. Mm-hmm. And so if you do the screener, it's about 2 to 3 minutes. You can do the full mini in the adult, which has 17 DSM-5 modules. That takes anywhere from 20 to 25 minutes. And in 90 seconds, you have a report back that tells the provider all the conditions that the patient meets the DSM criteria for.
Wow.
And you have all the independent answers so that you can dig into areas that the patient may have said yes to and begin to sort of quickly initiate the discussion around the problem areas. Mm-hmm. And then the tracking tools each probably take less than a minute and a half, and they can be sent out to the patient via email, and they can answer them on their phone or their watch or any number of ways to let you know how they're doing in between. So they're quick, they're efficient, they're extremely accurate. They've been validated over 25 years and are still constantly used today as one of the leading assessment tools in the world. So we feel comfortable that when people use our tools, they're getting good information. They're getting information that they can depend upon, and it can help them help their patient. That's really the key for us.
Yeah. Yeah. Well, I think it's amazing being able to have kind of that leg up, and just being able to know how to quickly work with clients and patients. What really stuck out for me about what you said is just being able to look at how they answer the questions and really kind of being able to hone in from there about, okay, this is something they've not mentioned before, but they answered this question in a particular way. Let's dig in a little deeper into this. Yeah.
It's exactly right. And often when people, and you can do these administrations a couple of ways. You can, actually hand the patient a tablet to answer these in your office. You can ask the questions in the office as part of your interview, or you can email the tools out in advance. And that's what we do at the college a lot. Mm-hmm. And then when the patient shows up, we automatically already have a diagnostic interview completed. Mm-hmm. So our therapists can begin right away to hone in on those key issues. And there's no sort of searching. I know right away this patient has anxiety, this patient has depression, and those are the things that I can look at, as you say, the answers to the question. So it's a very efficient way to get the information from people in a timely way.
Right. Oh, this is great. Well, I know that people will be interested in how they can find out more, Tom. And also, I want to be respectful of your time. Tell folks how they can get in touch with you or find out more about nView.
Well, you can go to nView, nview.com. Mm-hmm. All the information is there about us and how to get a hold of us. We have a strong team of people. We have a strong clinical advisory group. We're there to help people like primary care docs, therapists, and others really get the right information. So we have a great staff of people, wonderful folks who are happy to answer your questions. We have a process, on the website. So if you have a question, it's going to be generated at that moment right to somebody on the staff to be able to reach out to you either by phone, by email, however you wish to be contacted, and we can provide you information.
Awesome. Awesome. And we'll have links in the show summary and show notes for all of this so people can find it easily. So, Tom, well, any other parting thoughts you have for us and just thinking about, this whole coordination of care between the medical side and the therapy side and all of that?
I think the last thing, Gordon, I really appreciate the opportunity because I see this integration between therapists and physicians, particularly primary care doctors, as really key because the backstop for mental health in this country has become the primary care providers.
Mm-hmm.
And their ability to then help their patient get the therapy that they need through therapists like yourself, that's really going to be life-changing in this country for the concept of mental health. So I appreciate the opportunity to talk about it.
Awesome. Yes. And I'm so glad you joined me on the podcast, and hopefully maybe we'll have some more conversations in the future.
I would look forward to it.
Well, I'm very grateful to Dr. Tom Young for joining me on the podcast. And one of the things that I learned, early on when I first went into private practice is that your doctors and your primary care providers can be a wonderful resource for you, particularly, in getting referrals and that sort of thing. And I think to be able to share with them tools and that sort of thing, they're always looking for those. I know I've got several friends that are primary care physicians, and one of the things that they're always looking for is people to refer to when they figure out that a patient of theirs has some mental health issues that could benefit from therapy. So I'm so grateful to Dr. Young for being able to create the tools that he has. And you can check it out at nView Health. And again, there'll be links here in the show notes and the show summary for you to find out more about that and how you can maybe see about integrating that maybe as a tool with your own practice. So, again, I'm glad that you joined me for the podcast, and be sure and check out the Google Workspace for Therapists course before the price goes up at the end of this month of March 2021. As I had mentioned earlier, I'm putting some updates in for the course, and I'm going to close the cart at the end of this month, March 2021, and get those updates completed. But if you purchase it now, you'll get it at the original price, plus you'll get all the updates. You'll get those live, and you also have lifetime access to the course. And in the course, you're going to learn about the different tools of Google Workspace and how you can use them in your practice for making you more productive and helping you manage the whole business side of your practice. So be sure and check that out at practiceoftherapy.com/G Suite course. It's under the old URL still, but we'll get that updated here soon. But be sure and check it out. Also, be sure and check out our sponsor for the podcast, TherapyNotes, therapynotes.com. They're the leading electronic health record system for mental health providers in private practice. They're who I use in my practice, and I'm absolutely thrilled with the service they provide, but also how it keeps our practice running smoothly with scheduling and appointment reminders, also a payment portal. There is also telehealth included in the package that you get from TherapyNotes, and it's a well worth the investment. So be sure and check them out, and you can try them out for 2 months for free if you'll just simply use the promo code Gordon, just GORDON. Again, TherapyNotes.com. Well, folks, thanks again for joining me for the podcast. I'm hoping you're having a good week or weekend whenever you might be listening to this. I'm just thankful that springtime is finally getting here, and we're almost out of March already. That's hard to believe. This month just flew by, but the warm weather is returning, at least here where I'm living, and and it's just exciting. So anyway, take care, folks. Be sure and subscribe to the podcast if you haven't done so already, and leave us a review. I'm always anxious to get honest feedback about the podcast, and be sure and share with your friends. So take care, folks, and we'll talk to you next week. You have been listening to the Practice of Therapy podcast with Gordon Brewer. Please visit us at practiceoftherapy.com for more information, resources, and tools to help you in starting, building, and growing your private practice. And if you haven't done so already, please sign up to receive the free private practice startup guide at practiceoftherapy.com. The information in this podcast is intended to be accurate and authoritative concerning the subject matter covered. It is given with the understanding that neither the hosts, guests, or producers are rendering legal, accounting, or clinical advice. If you need a professional, you should find the right person for that.